This is lecture number 11 in NU210, Nursing Concepts. This comes directly from your Cataloma textbook. You see PowerPoint presentation number 11 is on cultural diversity. Let's define culture first. What is culture? What are cultural expressions? And we'll look at cultural orientation. So just write down some thoughts. What do you think culture is? We'll give you just a minute to jot that down. What is your definition of culture? And you can pause the audio and make those notes. Now you can post that on our discussion board or our blog on the portal. And when we're looking at cultural expressions, we first look at the language of the culture, then the spirituality of the culture. What is that culture's response to illness? And then we include the bereavement process in that. So in language, we know that this is simply how we communicate with one another. We usually assume that this is oral, verbally, but it can also be body language. It can be any number of idioms or mannerisms. And then some of the expressions of culture might be their spirituality. So you need to look at what not just the majority of the people in that culture believe and how they approach spirituality, but each individual subculture and each individual group or the family may differ in some way from the complete society's cultural beliefs on spirituality. And then how do they look at illness? What is their response to when someone gets sick? Do they believe that it is punishment from God or it's just the way things go? How do they accept it? How do they treat that illness? Is it something that is very, very burdening and grievous to them? Do they separate themselves from their society? Do they continue on as if nothing is wrong? Are they very stoic about it, or are they very emotional and very overt about their illness? And then what do they think about death and bereavement? What is their process of letting things go, especially when we're dealing with things that are alive and are part of their society? Learning process for cultural orientation begins at birth and it continues throughout the entire life of the person or of the culture. Those behaviors, beliefs, and attitudes are transmitted from one generation to the next. So father may pass it on to son, mother may pass it on to daughter, or vice versa. And a lot of times the expressions of culture are primarily unconscious. It's not something that we overtly do or purposely do. It's just part of the way that we live, and we share by example to our offspring what our culture is about. It may have a profound effect on an individual's interactions in response to the healthcare system. Someone who's raised in a culture that does not agree with taking pills or using medications, they're going to have a very negative response to the healthcare system in the United States, because it seems like that model is based much upon diagnosis and treatment through medications or pills. And of course, that may not bother them at all. So you have to look at each individual culture. Looking at some of the concepts of culture. Any individual belongs to several subcultures. So there may be many subcultures within just one family, because look at the adolescent subculture or the teenage subculture. How about the elderly generation? That's a subculture within our own culture. So you see where we're going with that. Subcultures develop when members of the group accept outside values in addition to those of their dominant culture. So they're not necessarily setting themselves apart or separating themselves or segregating themselves from their dominant culture. They're just changing up a little bit and adding to say, well, we belong to this culture, but we also in our own group are justifiably have our own values that we accept along with those of the culture that we live in. So even within a given culture, there are many variations that may exist there. What about cultural diversity? Well, diversity explains the differences between cultures. And we have the primary characteristics that are those that are more obvious, such as nationality, race, color, gender, age, and religious beliefs. Think about those for just a minute. Those things which set us apart. Nationality, race, color, gender, age, and religious beliefs. And then secondary, these are a little bit more difficult to define and identify. It might be socioeconomic status, educational status, your occupation, the length of time that you're away from the country of origin may determine how you take on those secondary characteristics. There could be gender issues that are involved, your residential status, or your sexual orientation. Now, Catalano points out these two concepts, one being the melting pot and one being the salad bowl. And they define the melting pot as those cultures that try to fit into the dominant culture by shedding the trappings of their native culture. We also call this acculturation. And the salad bowl has to do with cultures clinging tenaciously to their traditional cultural practice and languages with a minimal attempt to fit in. That's multiculturalism. Also looking at heritage consistency. When you blend the melting pot and the salad bowl together through a rather complex process, outwardly they appear acculturated to the dominant culture. At home or with groups from their traditional culture, they speak their native language, they wear their traditional clothes, they eat ethnically correct meals, and generally follow their native customs. So on the outside, they may look like society, but when they come home, they may even change their clothes. They speak differently, they dress differently, and they behave differently, and they may eat differently than when they're out among the public and society as a whole. How about in the U.S.? What are our ethnic population trends? Well, in the 2000 census, which is about 14 years ago now, approximately 30% of the U.S. population was composed of minority groups. By 2050, the white population will actually be a minority group consisting 48.9% of the total population of the United States. In some states, the white population will be a minority much sooner. So this points us to a great need for transcultural nursing, and we need to learn this in our bachelor program and take it out in our practice with us, because the percentage of minority nurses does not reflect the national population trends. So in other words, it is not conducive to the population. So let's say if we have 25% of our population are Native American, we don't have 25% of the workforce of nurses that are Native American. If we were to say that 50% of the American population are African American, well, the workforce is not made up of 50% African American nurses. So it's not something that goes parallel hand in hand with. So minority nurses have remained constant at about 10% of the workforce of RNs. And that's quite low when you consider the size of our healthcare institution and our healthcare system. The number of minority students that we enroll in most basic nursing programs remains at about 15%. So you see we have a little disparity going on here. In developing cultural awareness, it begins at home. Nurses develop cultural awareness only when they can recognize and value all aspects of a client's culture, including their belief systems, the customs that they use, their responses to society, the ways that they express themselves, their language, and their social culture. Merely learning about another person's culture does not guarantee that the nurse will have cultural awareness. And we're going to see this in practice, and as we go into clinicals, we'll see these disparities that exist, we'll see these contradictions, we'll see the problems that arise when we're dealing with different cultures. And a lot of times you just have to work through them in the institution, and you may need to develop policies and procedures and protocols that apply to those things. Many have dealt with language barriers by having translation lines that are available to patients, etc. To those that are unfamiliar with a particular culture's healthcare beliefs, many of the healthcare practices may appear meaningless, strange, or even dangerous. Beliefs about healthcare are based in part on knowledge and are often related to religious beliefs. Now, this is really going to come into play if you go to work for a healthcare institution that is based in a religious organization, such as Catholic, Methodist, or Baptist, and there are many of these hospitals around. When developing cultural awareness, we look at the cultural belief systems. We know that they are very complex. There's nothing simple about them, and sometimes it takes a lot of time to learn another culture and their belief systems. The beliefs practices are usually kept as closely guarded secrets. They just don't seem to want to let go of the information, so you may have to get to know someone for quite a while. Some of these cultures do not like to answer direct questions. They don't like to be probed or their systems inquired about. They are very secretive. There may even be some type of sanction or punishment for members who reveal the beliefs that they have in their belief systems. And they develop over time from a trial and error process. Now, looking at changing the client's healthcare values. Recognize that the nurse comes from a particular culture that has its own set of healthcare values. So this is going to affect the way they give care or the way that they view the healthcare system that they work in. You need to identify the culture of the client and recognize specific healthcare practices. Now, it's about the client, so the thing is, you've got to make some changes in your own belief system and your own values without forfeiting the core of them, but you've got to make some adjustments in how you deal with your clients, because you've got to recognize that they have certain beliefs themselves, and you've got to work with the client's beliefs and cultural values to make changes that will improve their health. So you've got to see, how can I convince this person in the way that they can understand and that is culturally conducive to them, that they need to make some changes to improve their health. And you've got to know, first of all, how do they view health, how do they define health, and how do they treat illness and disease within their culture. Now, when you're doing a cultural assessment, and a lot of times this is done on computer system, or it may be done on paper, but the nurse needs to ask, why do you think you are ill? What caused the illness? What was going on at the time the illness started? How does the illness affect your body and health? Do you consider this to be a serious illness? If you were at home, what treatments or medications would you use? How would these treatments help you? What type of treatment do you expect from the healthcare system? How has your illness affected your ability to live normally? If you do not get better, what do you think will happen to you? These are very important questions. We need to learn the basic structure of these questions when we're speaking with our clients and doing a cultural assessment. Physical variations in assessment. The nurse must know the basic biologic and physical variations among ethnic groups. So that's on a range from Caucasian to African American to Chinese, Asian, Eastern Asian, Middle Eastern, very middle Africa, maybe different from North Africa, from South Africa, and these findings may be affected by ethnic variations in anatomic structure or characteristics. So what's different about these racial groups physically or anatomically? You need to be familiar with those things. Sometimes these are learned through time, sometimes they're learned through textbook theory. There can be changes in skin color that may affect the interpretation of assessments or findings. So you need to know what something looks like on an African American as that might be different from a Caucasian. Because we want to give culturally competent care. Cultural competence as it relates to nursing is the provision of effective care for clients who belong to diverse cultures based on the nurse's knowledge and understanding of the values, customs, beliefs, and practices of the culture. Now, the primary skills that we as nurses are going to need to have is communication skills, skills that relate to understanding, and skills that relate to sensitivity. We need to be sensitive to the beliefs and needs of a subculture or a different culture altogether. We are a global community, and some of you may be caring for clients that are across the globe on the other side of the world. Now, when we're looking at communicating between cultures, there are some barriers. First of all, there can be a lack of a common language. So we are dealing with that in our southwestern states, especially because we have many people coming across our southern border. There can be a lack of understanding nonverbal cues. We may not understand where men and women fit into society, so they may view the role of men and women as being differently or completely equal in another culture, but you've got to know that, you've got to learn it and understand that when you're taking care of that client. Do they use loud or aggressive tones, or are they very quiet? Are they very soft-spoken? Are they aggressive as far as volume goes? Do they get close to you and speak loudly, or do they back away and speak loudly, or back away and speak softly? Are they confrontational? So there are the nonverbal responses. We have to take a look at speech patterns. We have to look at the personal information and trust. Open-ended language, that's the opposite of a yes and no type conversation. Do they allow touch? What is that culture believe about touch, and how do they believe about personal space or making eye contact? They may or may not like eye contact. All of these things are very important when communicating with another culture. And you've got to basically research what's going on there and find out how is it that these people deal with nonverbal, with their speech patterns. Do they trust people? Are they very personal? Do they give out information about themselves easily? Um, do they like to have conversations in which they can share their opinions at any time? Do they interrupt? Do they touch while they're talking? Do they like to be close to a person when they're speaking with them, or would they rather be greater than 3 feet away from them? And then there are some cultures that do not like for you to look them directly in the eye when you're speaking with them. They gaze either to the side or up or down. Now, some cultures may be offended by that, and they want you to make very, very aggressive eye contact with, eye contact with them. So it just depends on the culture. Look at the differences between Native Americans and Chinese Americans and um, the Middle Eastern cultures, and kind of research that on your own, and go on the internet and do a few searches and see if you can discover some of these differences that we have. And then you will be able to explore these things as you progress through this program and get into your transcultural nursing class. This is just kind of an introduction, and we don't want to say that we've covered everything here, but we've just kind of touched upon the basics, and you will pursue this when you enter into that course called Transcultural Nursing. So that concludes this little lecture for today.